फिरोज भाई के साथ कहाँ चली गई? देखो मूछा तो भाग गई।
फिरोज भाई चला गया. After seeing Jyoti running away from him for 2 years,
हाँ.
now it is his time to go away.
Sir, it's gone live now.
Yes.
Yes,
It's
we
gone
can
live.
start. We can
Uh,
start.
Nilesh,
Yes, ma'am, I'm starting.
so start it, please.
Yes, ma'am. So, good evening to all respected faculties and delegate members who are present over here. I am Nilesh Darji from Corona Remedies. Welcomes you all in this 161st edition of Happy Learning Masterclass webinar series in association with State Organization of Gynecologists and Obstetricians of Gujarat, jointly with Bhuj, Jamnagar, Junagadh, Porbandar, and Rajkot. And today's webinar's theme is Mixed Bag. Convener for today's webinar is Dr. Asha Jain. So let me introduce Madam. So Dr. Asha Jain is currently Director SMSA Hospital Raipur. Madam is Medical Director Cancer Prevention and Relief Society, elected member of Chhattisgarh Medical Counseling, Vice President IMH Chhattisgarh. And Madam has also very vast experience of 32 years in obs and gyn field, and Madam has FOXY Register Ultrasound Training Center, Colposcopy Training Center, and Madam's fields of interest are saving the uterus, fetal medicine, ob and gyn, ultrasound, critical care, preventing oncology, and colposcopy. So I welcome you, Madam. And as per the traditional course, I would like to start the session with lamp lighting ceremony. Thank you so much, all the respected doctors. Now I hand over the session to Dr. Asha Jain. Madam, over to you.
Thank you, Nilesh.
Thank you.
Welcome all the dignitaries to this 161st edition of Happy Masterclass, conceived by Dr. MC Patel, sir, and has been held through these 160. Previously, Dr. Sneha Bhuyar was the convener. Then Jyoti, Dr. Kalpana, Dr. Rekha, Dr. Bharti, Dr. Kanchan. There were a lot of people joined into it who have now various posts and have shifted. Now I have taken over as convener, and I was there before for many months as coordinator with sir. So sir, I would like you to welcome our guests officially for this program.
Yes. Thank you, Dr. Asha. It gives me immense pleasure to welcome you all on 161st episode of Happy Learning Masterclass web series. I welcome Dr. Pankaj Desai, good old friend, and he's always kind. He's always kind with me in any of my academic activity. He has spared time from his busy schedule to bless this webinar as a chief guest. So welcome, Pankaj Bhai. I also welcome Dr. Deepak Bagde, my good old friend, classmate, and he is also always with me in any of my activity. So welcome Dr. Deepak Bagde as a guest of honor to bless the webinar. I also welcome Dr. Gopal Hirani, immediate past president of SOGOG. He is also with us in any of our activity. So welcome Gopal Hirani. I also welcome in his absence rather Dr. Sudhir Shah. He is unable to join due to some reason, but he has also kindly consented and he has sent us a blessings and good wishes for success of this webinar. I also welcome learned speaker, Dr. Ami Mehta. She is going to discuss very interesting topic about adolescent and PCOS. I also welcome Dr. Kamini Patel, President SOGO, is special guest for today's webinar, and she will be joining soon for her blessings also. I also welcome all the chairpersons who have kindly consented to chair the session. Dr. Neeraj Jadhav from Rajkot, Dr. Nita Sata Madam from Jamnagar, and Dr. Raju Doshi from Junagadh. I also welcome all the learned panelists who have kindly consented to join as a panelist, and they are going to bombard questions related to POXO Act towards me. So I welcome all the panelists. Dr. Puneet Khatri, President, Bhuj Society, Dr. Bhavik Khatri, Secretary, Bhuj Society, Dr. Hinaben Patel, President, Jamnagar, Dr. Deepal Bhalodia, Secretary, Jamnagar, Dr. Varsha Dhruv, Madam, President, Rajkot, Dharmesh Patel, Secretary, Rajkot, Piyush Wadalia, President, Junagadh, Devraj Badarka, Secretary, Junagadh, Hira Kudiatar sir from Porbandar, he is President, Porbandar, and Jignesh Modi, Secretary, Porbandar, and Dr. Hetal Modha from Rajkot, Dr. Dhiren Taravia from Rajkot, Dipti Vyas Madam from Jamnagar, Nalini Anand Madam from Jamnagar, Jigna Ganatra from Rajkot, and Madhav Hirani from Bhuj. I also welcome Dr. Asha Jain, convener of this series, and she has took lots many pain to prepare this webinar. I also welcome two learned coordinator, Dr. Rekha Rajendra Kumar from Bengaluru. She in this series since long as a coordinator, and Dr. Bhavik Khatri, Secretary of Bhuj Society. He has also taken pain as far as this webinar is concerned. So many times I have told during my welcome address in this type of webinar, in era of COVID-19 where physical meetings were not possible, I started this series inviting 3 more friends, and with those 4 friends we started this series. And now I am happy to announce that we are 7,000 plus member family as far as this Happy Learning Masterclass web series is concerned. And this is 161st episode of our Happy Learning Masterclass. And we usually used to discuss focus topic, and goal was to meet our Foxian friends on virtual ground to discuss focus topic, and ultimate goal was to be useful to our patient and to check maternal and infant mortality. Because by 2030, WHO and Government of India has given us a target that maternal mortality should be less than 70, that is, it should be 67, and infant mortality should be less than 12. Of course, there are few states in southern India, they are near 30. And as far as Gujarat I can quote, then it is less than 50. So we are quite good in position, but still there are few states, particularly in northern India and particularly in northern eastern India, they are having maternal mortality near 200. So still long way to go to check this maternal mortality, and it is joint venture only on part of government, NGOs, a federation like IMA, Foxy, and our obstetrician friend, and particularly obstetrician friend who are working in remote areas. And if they can pick up high-risk pregnancy cases, and if they can manage to get them delivered or to be treated at proper place, at proper time, then definitely we can check maternal mortality, because previously it was near 300 and now it has come down slowly, and now it is less than 100 as far as Indian data is concerned. So it is almost possible to go with this target also. So with this aim, we had started this series, and I welcome all the president and secretary of societies who have joined this webinar, all the delegates, and all the learned faculty. So thank you very much.
Thank you, sir. Thank you. Now we have 2 coordinators for this program. We have Dr. Rekha Rajendra Kumar, who is the incoming, who will be becoming the president of Bangalore Society in 24. And we also have Dr. Bhavik Khatri, who are the coordinators here. So before I hand over to Dr. Rekha to introduce Deepak's Pankaj Desai sir, Dr. Bhavik, would you like to say something?
Bhavik,
Yes.
yes.
Thank you very much, ma'am, for giving me time to say a words to this webinar. I personally want to thank Dr. MC Patel sir for giving me this opportunity to become a coordinator. I always learn many things while coordinating with multiple societies and everything. Since last few months, I have been working with MC Patel sir in coordinating some of the webinars. So just like sir, I used to have some CVs with me now of some of my friends so that the work can be summed up very nicely.
Yes.
Looking forward for your support in future as well. Thank you, sir.
Thank you. Welcome. Always welcome.
Thank you. And now I would like to invite Dr. Rekha Rajendra Kumar. Nilesh, may I have her CV, short CV, and then she will introduce Pankaj Desai, sir. So, Dr. Rekha Rajendra Kumar is a practicing gynecologist for 31 years, and she has a lot of academic excellence, President-elect BSOG 23 to 24, invited faculty in many national and international conferences, South Zone Coordinator, Foxy Infertility Committee, and much, much more. So Dr. Rekha, welcome, and over to you to introduce Pankaj Desai, sir. Please display the CV of Pankaj, sir.
Thank you, Dr. Asha Jain, madam, for the nice introduction on me. Thank you, MC Patel, sir, for allowing me to coordinate this session. It's my proud privilege to introduce none other than very polite, well-knowledged and a treasure of so much of knowledge, Dr. Pankaj Desai, sir. Sir, I have communicated with you many times before, and every time you have been so gentle to me. So let me introduce you, sir, to the audience. Sir is a great academician, teacher, scientific researcher, and inspiring public speaker. That's a very great thing. And sir's present position, he is a consultant obstetric gynecologist, obstetrician gynec specialist in Janani Maternity Hospital in Vadodara. Positions held Dean of Students Medical College, Baroda. Sir is Associate Professor and Unit Chief, Department of Obstetrics Gynecology, SSG Hospital, Medical College, Baroda. Sir has received lot of gold medals and the awards, international and national awards. And that's a very great list. It's a very big list and many things to say about sir. The number itself speaks volumes about sir's achievement. The oration itself is 61. I cannot imagine that number. It's a very huge number. Lot of guest lectures, 776. My God, sir, it is too much of an achievement. I can never think of, can never imagine. The books authored 13, research papers are 9, contribution of chapters in different textbooks 45, and blogs written are close to 100,000. Sir, we are so happy and extremely honored to have you here. Your presence is a very treasured one. Sir, we would like to listen from you, sir, please.
Honorable Dr. MC Patel, sir, someone whom I can never call sir, Dr. Deepak Bhagde, very dear people to me, Dr. Gopal Hirani, Dr. Raju Doshi. We don't call him Rajesh Doshi, though his name written here is Rajesh Doshi. For us, it is Raju Bhai, Dr. Jyoti, Dr. Sneha, Bhavik Bhai. Thank you for taking the joke so well. The presidents and other office bearers of different societies of the state organization, and the person who has maximum halo around her today of knowledge, Ma Saraswati, is going to sit here, and that is Dr. Amiben Mehta. That is a fact. Ma Saraswati sits here because everybody has Ma Saraswati here, but to get it translated here, you require something special. I never, since before pre-corona days, I remember once I was inaugurating the Chhattisgarh annual conference, the Jharkhand annual conference, and that is where I told that I will not give the routine lecture. I always tell stories. And I love to tell stories, and as far as possible, I do it in such a way that I am conscious of the audience so that it is not repeated as far as possible. I hope today's one is also not repeated. It is based on a true story, but for anonymity, the location, the identity, the genders also have been changed so that you will not be able to make out, but it is based on true story for sure. And the title of the story is Hello Kidneys, What's Up? Out of the blue flashed the tweet on the social medium Twitter one day. My dialysis is becoming very draining for me financially. Oh, how I wish I die. Oh, how I wish I die. It stopped at that. One obstetrician and gynecologist like you and me read it. She sensed the pain and helplessness of the person who had tweeted. That is what doctors are, very sensitive people. The reader knew nothing about the person who had put up this stress call. For inexplicable reason, something made her send an immediate personal message. Can I have your mobile number, please? The person who had tweeted was actually a lady in the 4th decade of her life. She was from a town in Madhya Pradesh and was diagnosed as a young primary hypertensive for many years. Then this tragedy struck. Theirs was a comfortably resourced family who was buying all treatment for hypertension with ease. But as they say, when tragedy strikes, it strikes en masse. खुदा देता है तो छप्पर फाड़ के देता है. Even in tragedies, वो छप्पर फाड़ के देता है. Her father was actually a successful businessman who faced suddenly a massive loss in business. Out of despair, he committed a suicide. The shock took away the mother also in less than a year. This left behind her, she and her 2 elder sisters. She was engaged to a boy whose parents called off the engagement as soon as the financial difficulties became known to people. She stopped taking treatment for hypertension as monetary problem took its toll. As she was having vicious hypertension, her kidneys bore the brunt and eventually failed. One of her sisters was very kind and was married in an equally kind family, offered her kidney to her. A wealthy first cousin who had become very prosperous thanks to her father's help, offered to bear all the expenses for the renal transplant. The surgery was successful. She resumed her work of taking private tuitions. As a teacher, she was very popular, but the income from tuitions had its limitations. She was not able to buy some very costly medicines that were required on a long-term basis for the transplant. The result, she couldn't take all of them. Over a period of time, the transplant also failed. Soon, as a side effect of some antibiotics, she lost her hearing faculty completely. She can speak currently. She can speak fluently, but she can't hear. Now came the need for dialysis, a long-standing recurring expense and an unbearable suffering. This drained her off completely. Her tuitions continued on non-dialysis day without her hearing faculty. She teaches. She is such a good teacher that she is getting students. But the recurrent expense of dialysis was brutal. She tried the government sources for help, but could not succeed. She could not arrange for the bribes for intermediaries to be paid, though the government missions are very good. She maintained herself on a meager diet, consuming only 1 vada pav for lunch and 1 vada pav fixed for dinner with few sips of water. I am telling you a true story. There is no concoction. Obviously, she remained hungry. She was forced, therefore, to tweet, "My dialysis is becoming very draining for me financially. Oh, I wish I die." That is when the obstetrician and gynecologist read the tweet and sensed the desperation. she messaged offering her help and support. The lady who was going to be helped asked, any precondition? That lady put one precondition, only one precondition. No one should know about this support. It should remain completely anonymous. She shared her bank details to the donor, and the lady doctor, and every month, regularly on 1st or maximum 2nd, a dignified amount got transferred to her account. With the new support, she could buy a better dialysis facility and the medicines that were needed. This routine went on for more than 3 years. The story doesn't stop here. But it seems destiny had other plans to test the donor as well as the recipient. The recipient's condition worsened, and she needed more dialysis sessions per week. Her drugs became more costly as times passed. She did not share this with anyone, but took one more tuition with a challenged hearing facility, cancelling her Sunday offs. One day, as if by some divine ordain, the lady randomly messaged the patient, the dialysis recipient. How are you doing? At that, she broke down. All communications were occurring through WhatsApp text messages. There was no question of phone call because she couldn't hear. She shared now her agony. She shared in pain that she may have to skip one session of dialysis every week to make her ends meet if the situation didn't change, or as she painfully put, or if I don't die. This alarmed the donor, the lady doctor. She thought hard and just thought of exploring and involving some friends. That is where her husband also encouraged. Her husband means our OBGYN's husband. Now I am shifting a little. Groups on social media usually are for socializing, for gossiping, for political reasons, to get votes, this, that, blah, blah. Many heterogeneous reasons. They may or may not serve much purpose. Most of them don't serve much any purpose. The doctor concerned was also a member of many such groups on WhatsApp. She wondered if she can put an appeal in this group. After lots of thinking and discussion with her husband, she finally put a message in the group. And lo and behold, there was a flurry of offers. Flurry of offers. I will tell you the challenge. The challenge is not in one offer. Just look. We obstetricians and gynecologists are doing this. Means like us. She requested for 12 volunteers and she got 14 doctors who offered to help. 12, one each for 1 month. All this was happening through private messages and an occasional reference in the group. The reason behind the anonymity was to preserve the sanctity of the supported act and avoiding any publicity. Probably, as they say, keep your camera at home when you are doing a good job. When you are doing a good deed, keep your camera in your cupboard. Today, 3 more years have passed. She continues to send her support every month, and one member by rotation, everyone from that WhatsApp group duplicates it. With this, the total support has doubled. This was most inspiring. One-time support is easy, but continuously every month, without any name or fame, for last 6 years for that donor lady, and the last 3 years for members of a WhatsApp group, this is going on. None of you know it. None of our supporters have met her ever in person. None have talked with her in person. None have tried to show some obligation on her. But the Ganges of support continues to flow incessantly from a group of obstetricians and gynecologists like you and I. This renewed leash of life has made the donee confident. It has affected all spheres of her life, She is nutritionally better now. It is not that the crises are over. Amit, she had a fall, and those of you know about renal transplant, their parathyroids are very precariously balanced. She broke her hip. She required a fracture correction and all, which was arranged by that donor who arranged for her transplant. But she positively fought back now that she had the courage. And because of that, she is now on her feet and is able to walk. Nevertheless, the simple looking support has made her so confident that it seems now she wants to take on anything and everything. One small support and an entire life bloomed. And let me share only this much with you. There are 3 donors sitting on this panel who are donating there silently. On your very panel, MC Patel sir, I will not give their names because they will not like it. Such noble people we have. One small support and an entire life bloom, all thanks to a mundane, useless looking WhatsApp group. Thank you, ladies and gentlemen.
Thank you, sir. Thanks, Dr. Pankaj Desai, for that very genuine, very honest, heart-touching story. And that has inspired many of us here, I'm very sure. Dr. Asha, please.
May I have the CV of Bhagre sir? Thank you, Pankaj Desai sir. That was very moving. And to think that those donors are sitting here. So welcome, Dr. Deepak Bhagre sir. He's the past president of SOGO, past MD DGO with gold medal in 1981 from Ahmedabad. He was the head department of Gynec, MP Shah Medical College, Jamnagar, scientific committee chairman, Gujarat, SOGO, president, Jamnagar Gynec Society. He gave the first ever SOGO oration 2014 and has delivered about 62,000 babies in private practice. And all of us gynecologists know him more by him running the Foxy Friends group, in which everybody who has a birthday gets a wish. So over to you, Bhagre sir, for your words of blessings.
Asha, that was, I don't know. Good to hear something about me, but I really don't deserve whatever you say. But thanks for all the blessings is the only thing I would say that I'm amongst the friends. Dr. MC Patel has been a classmate, a friend since we started our medical, in fact, not even medical college. Pre-medical, we started together in the year 76.
73.
And 73, yeah. 72 we started, 73 we joined the medical college. And then, since then, we have been continuous friends. Dr. MC Patel, 161 episodes, that means it's almost 3 years. How you do it every year, we really don't know. But this zest and enthusiasm surely is touching everyone. Fortunately, I'm called for a webinar just once in a week. But suppose if I'm really called even once a month, I think I'm going to run away. But with support from seniors like Pankaj Bhai, my friends here, Dr. Raju Doshi, Hirani, Asha, Rekha, Ami, the presidents and the secretaries of the Bhuj Society. I mean, all the societies included, I won't name because we want to really deliberate what you really are here for. But just everyone knows that Dr. MC Patel is aspiring for the post of Foxy next year. And as we can see, he really deserves this post. And I hope not only support Dr. MC Patel, but let's also work for him so that we get our own president in Foxy next year. Dr. MC Patel, all the best to you. Pankaj Bhai, that was a heart-touching story. And I'm sure you must have led that part without naming anything, but it was a touching story. And I'm really happy that you did something good for the society. Thank you very much.
Thanks,
Dr. MC.
Thank you, Deepak, for kind words and all the good wishes.
Dr. Rekha.
Yeah. Sir, thank you so much, Dr. Deepak Bagde. As Dr. Asha said, I have seen lot of happy birthday messages and you inspire. You are a very lively person on the Facebook. We see your posts almost day in and out, and your presence is always felt everywhere. Thank you, Dr. Deepak, sir, for your
Yeah,
presence
I mean,
and your good wishes to us. Thank you, sir.
Dr. Asha, just if I take one more minute.
Yes, sir.
Yeah.
Yes, sir.
Please,
Okay, we have a Foxy Friends yearly meet, which is in Foxy President's calendar. We just said it last week. And next year, probably we'll have in Amritsar. This is a family meet where we invite all the family members to join us so that they get closer to the Foxy leadership, your one-to-one touch, and you got to really experience what a Foxy Friends meet is. Those who missed out in Goa this year, I'll be very happy to see them in Amritsar next year. Thank you.
Thank you, sir. Thank you.
Thank you so much, sir. Dr. Asha?
Yeah.
So, Dr.
You have to introduce
Gopal.
Dr. Gopal.
Yeah, that's what. Dr. Gopal
Nilesh,
Hirani, sir.
Nilesh, please.
Can I have, yeah. Thank you, Dr. Gopal Hirani, sir. Sir is the past president of SOGOG. We are so happy to have you as the guest of honor here, sir. Fortunate to share screen with you, and we would like to listen to you. Before that, I would like to give a very short description about your CV. Sir is selflessly serving people of Kutch for more than 3 decades, pursued his MBBS and MD from MP Shah Medical College, Jamnagar, pioneer in Kutch to provide advanced services like ultrasonography, endoscopy, and ART procedures. He's a professor at GAIMS Bhuj, founder secretary of Bhuj Obstetrics Gynec Society since 1995. Sir is also was the chairperson for SOGOG 2004 conference and 2021. He was the president of SOGOG from 2021 to 2022. I'm very sure that sir has a lot of achievements, but the CV is very short. We would like to listen to you, sir. Over to Dr. Gopal, sir.
Thank you, ma'am, for the kind words about me. And first of all, congratulate our respected program director, Sir MC Patel, and convener Asha Jain, ma'am, and coordinating all of us by Bhavik and Rekha Rajshekhar on edition webinar. So it is a very long series, and always MC Patel sir is always encouraging all academic activity, and also so many any difficulties in arranging any type of conferences. So he's always remains as a advisor. With our guest presence of Sneha Bhuyer ma'am and Jyoti Banglowala ma'am. Today, the adolescence PCOS, really it is a very at present era. Previously, in early start of practice, we are not seeing so many patients, but at present, the PCOS is so common that each and every young girls come with a menstrual irregularity and some and other relevant diseases. And also, nowadays like a POXO, the protection of children from sexual offenses is so common in the school age, teenage students, due to the some lifestyle improvements. So our all president, secretary, dignitaries, Bhuj, Junagadh, Jamnagar, Rajkot, and Porbandar. So by all experts, it will be highlighted a new focus regarding this new act, or actually very uncommon discussed act. My wholeheartedly best wishes or success of this webinar, and every each moment is very lively. Thank you, sir. Thank you all to meet you.
Thank you, Gopal Bhai, for sparing time to bless us. Thank you very much.
Thank you, Gopal, sir.
Thank you, sir. Now, with your permission, we will end this inaugural session, sir, and we will start the academics.
If Dr. Kamini has joined, then we can have blessing from her, or
Sir,
we can start academic session. And whenever she joins, we will have blessings from her at that time.
Yes, sir.
Oh, yes. We
So
can switch
over
on.
to you, Dr. Rekha.
Yeah, thank you, Dr. Asha. As Dr. Asha said, the inaugural ceremony is over. We shift to the academic session. In that, we have two parts. The first one, session 1, is a talk on adolescent PCOS by Dr. Ami Mehta. And the second one is a reverse panel, that is Stump the Expert on POCSO Act, where Dr. MC Patel sir will be the moderator and taking questions from all the panelists. Now, let us talk about the adolescent PCOS. For that, I invite the chairpersons, Dr. Neeraj Jadhav, Dr. Neeta, and Dr. Rajubai Doshi. Can I have CV of Dr. Neeraj Jadhav? Nilesh? He's the chairperson of Sexual Medicine Committee currently. I can't see him.
Sorry to interrupt you. Actually, sir will probably not join. He has another meeting.
Yeah, I can't see him also.
Yeah, Dr. Neeta was going to join. So if you would just give a 2-line introduction, please.
Yeah, Dr. Neeraj Jadhav is the chairperson, Sexual Medicine Committee currently. Dr. Neeta Sata, can I have Madam CV, please?
She was traveling and I don't know whether she's going to join or not.
Dr. Neeta, she has her own center, that is Sri Dwarkadish Hospital, which has infertility, gynec endoscopy, and high-end sonography center. Madam is the organizing secretary of SOGOG 2019 Jamnagar. Can I have the CV of the third chairperson, that is Dr. Rajubai? Yeah, sir is the senior most gynecologist of Junagadh, past president of SOGOG. He has passed his MD and DGO from KM School of Postgraduate Medicine. So thank all three chairpersons, and Dr. Neeta, if she is there, I can't see Dr. Neeraj. If Dr. Neeta is there, I request Dr. Neeta. Yeah, she's there. I can see. Thank you, madam, for coming and joining our session. I request you to introduce the speaker, that is Dr. Ami, as well as brief description about the topic. And I request Dr. Raju Doshi sir to conclude and give his concluding remarks. Over to chairpersons, please.
Thank you, Dr. Rekha. Good evening, Dr. Asha, Dr. MC Patel, sir, Dr. Raju Doshi, sir. Hello, Dr. Varsha Ben, Dr. Jyoti Banglowala, Dr. Ami Ben. So nice to see you all. It is my actual pleasure to invite my beautiful friend, senior friend, Dr. Ami Mehta from Rajkot. Hello, am I audible?
Yes, you are audible.
Yeah. Dr. Ami Mehta from Rajkot. She has remained the president of Rajkot OB&GY Society and president of Rajkot chapter of Indian Menopause Society. She has a special interest in laparoscopic surgery and preventive oncology, and she has delivered more than 800 lectures regarding public awareness related to women's health. She is an active Rotarian and has received a Most Active Rotarian Award, a President Award in 2013, and still working very actively regarding nutrition and health for women. Over to Dr. Ami Mehta for her lecture for adolescent PCOS.
Sisters ko pakadenge.
Yes. Yes, Ami Ben.
Yes. First of all, good evening, everyone. Is my screen visible, sir?
Yes, it is seen. So make it full screen.
Yes, sir. So, respected seniors and my fellow colleagues and MC Patel, sir, thank you so much for giving me the opportunity. And we are wishing you a very bright future ahead, sir.
Thank you.
So coming to the subject directly, PCOS, today our topic is adolescent PCOS. It is an endocrine disorder with an average incidence of 10%. But the most important thing is we have a different criteria for adolescent PCOS than the adult PCOS that we will see today. Perfect diagnosis is important. Management is also very important. And to prevent the long-term complication is also important. And today we will learn what is at risk of PCOS. So simply to regularize her cycle, for her acne, hirsutism, or weight, we are learning PCOS in adolescent? No, it is far beyond that of her future fertility career and metabolic complication, hypertension, metabolic syndrome, and many more things. So according to WHO, the adolescence is 10 to 19 years. And in the early pubertal development, the features are similar to that of PCOS. They are having irregular cycles for 1 to 2 years. They are having mild acne. Ovaries will be multifollicular on ultrasound, and this is all because of immature excess, and that will get settled down within 1 to 2 years. Then how to differentiate between these two? So for perfect diagnosis of PCOS, the most current criteria is they must fulfill both the things, that is menstrual irregularity, oligoanovulation, and hyperandrogenism, the clinical features, and or the biochemical. So if these two are present, then only we can stamp the girl as PCO. So if the age of thelarchy, when the breast development starts, it is 9 to 10 years. And then after 2 years will be menarche. So that will be around 11 to 12 years. So once she has started, the age at which she has started menarche, the later part is considered as her gynecological age. This is very important, as if she is, for example, 15 years old and her age of menarche is 12, her gynecological age is 3 years. So what is by definition irregular cycle, or which adolescent we will include for PCOS? So initially for 1 year post menarche, all the cycles will be irregular. So that we will consider as a normal pubertal transition. After up to the 1 to 3 year of gynecological age, so 1 to 3 years post menarche, any cycle longer than 45 days or shorter than 21 will consider as irregular cycle, and more than 3 years post menarche, any cycle longer than 35 days or less than 8 cycles per year will be included in this. And if after 1 year of post menarche, if any cycle she has not get periods till 90 days, that we can say secondary amenorrhea, and that we will include in this. So primary amenorrhea by the age of 15 years is also included in the definition. This slide is very important to diagnose one of the signs of PCOS. And after thelarchy, routinely within 1 to 2 years, the menarche will start. But if after thelarchy, 3 years after that, if she has not started the menstruation, that will also give us the clue. So patient of an ovulatory cycle may be as a primary amenorrhea, secondary amenorrhea, oligomenorrhea, or polymenorrhagia. Now, second symptom is clinical hyperandrogenism. So if we are seeing acne during pubertal development also, but here the acne will be moderate to severe variety, not only on the face, but look at her back, shoulder, buttocks. That gives you the clue that this might be because of hyperandrogenism. The lesions will be more than 10, it will be inflammatory in nature and will not respond to local treatment. Second important sign is hirsutism, which is by modified Fairman-Galway score equal or more than 4 to 6. But hirsutism is sometimes also, it's an evolving process. So even if her testosterone is high, she will gradually develop the hirsutism, but it is one of the surest signs of PCOS. And female pattern of hair loss, frontal balding, and virilization. So any sign of clinical hyperandrogenism is also included. So if she has these two features together, or biochemical. So what is biochemical hyperandrogenism? More important is calculated free testosterone. So whenever you offer the investigation, put as calculated free testosterone or free androgen index. And it is not by the radioimmunoassay, that will not be perfect one, but tell them to do by high quality assay like liquid chromatography or mass spectrometry or equilibrium dialysis. And look at that the girl should be 3 months of any hormonal preparation. So generally looking at the girl, we always prescribe FSH, LH and all routine investigation. But what important is give free testosterone or free androgen index. FSH, LH is advisable when you are suspecting hypo or other things, not as a routine. Then if you look many a times as a in investigation, there is total testosterone. If it is less than 60, it is normal. Mild to moderate, it is 60 to 200. And when it is more than 180, think, and along with that, she has hirsutism, which is severely progressing and signs of virilization, then think of adrenal or ovarian tumor. Now, when to offer 17 hydroxyprogesterone. So whenever there is a PCOS, it may be secondary PCOS because of hypothyroidism, hyperprolactinemia. So TSH and serum prolactin is important. But to rule out congenital adrenal hyperplasia, generally this girl will start premature puberty. So before the age of 8 years, she had pubic axillary hair, acne. She has premature onset of hirsutism, generally has family history and some ethnicity. Now it is clear that we need two things. One is irregular cycle, the criteria are given. Second thing is hyperandrogenism, maybe clinical and or chemical. So whether we will offer pelvic ultrasound, no, it is not advised to diagnose because generally pelvic ultrasound will overdiagnose the PCOS. Normal pubertal ovary are also multifollicular. The ovarian volume will be reached at its peak by age of 20. It is continuously changing the volume and follicles. Only it is done post-menarche 8 years for the diagnosis. Any adolescent, increased volume of the ovary is more important than the number of the follicles. So if you have two things on hands, pelvic ultrasound, we are doing for other causes if she has severe dysmenorrhea, if she has pain in lower abdomen, or if we want to do any ovarian mass, or if we are suspecting Mullerian agenesis, then we can do. But per se, for diagnosis of PCOS in adolescent, pelvic ultrasound is not required. Serum AMH is also not included in the diagnostic purpose. Now we will see what is at risk of PCOS. Some features of PCOS are there, but she is not fulfilling both the criteria. So in such girls, you have to treat her. You have to manage her problems. You have to do her regarding her menstrual irregularity and everything. And just do her follow-up after post-menarche. If 3 years after that her symptoms continue, then again look for her menstrual cycle. And again here also USG is advised 8 years post-menarche and avoid premature labeling, but write down at-risk PCOS. So these are few examples of at-risk PCOS. Suppose if the girl is of 16 years of age and her menarche is 12.5. So it is around 4 years post-menarche. Her cycles are more than 40 days. So it is more than 35 days and she has mild acne. So we can put her at risk of PCO. Looking at the etiology, the insulin resistance and androgen excess are the main culprit. This is little busy slide, but what I want to stress here is hyperandrogenic intrauterine environment, which is one of the culprit for onset of PCOS. So the things is starting from mother's womb. Mother who is already having PCO, she is obese, GDM, preeclampsia, there is hyperandrogenic milieu, improper placentation, maternal malnutrition giving rise to IUGR fetuses, maternal exposure to bisphenol and nicotine, maternal stress and luteoma of pregnancy. These are creating hyperandrogenic milieu in the mother, and similarly they are creating hyperandrogenism in the fetus too. So if we want to reduce the burden of PCO, we have to address the woman at preconceptionally for PCO and weight gain, and all the mothers during her ANC for GDM and preeclampsia, we have to treat them perfectly. So which are the child at risk? Child who was born as IUGR, large chordate, mother with PCO, rapid weight gain during prepubertal age, obese children, premature puberty and precocious puberty. So already if the child is having hyperandrogenic atmosphere inside the womb, When they deliver, if they are IUGR or large for gestational age, they have rapid catch-up growth. And during the pre-pubertal age, because of the not a proper diet or lack of exercise, ultimately they'll end up with the obesity, and here the insulin resistance starts and the whole cascade of PCO hyperandrogenism will start, and the vicious cycle will go on. So we have to concentrate on two things. First is childhood obesity, and second thing is maternal PCO preconceptionally and during conception. Then and then only we can reduce the burden of PCOS. The history taking, what diet she is currently taking, how much exercise, whether she is stressed, anxiety, depression, sleep disorder, family history of PCOS, and from mother, her history we can take. The examination will include height, weight, body mass index, waist, hip circumference, its ratio, take blood pressure, look for the acanthosis, generally abdominal wall stria, fat distribution, breast for galactorrhea, hair distribution, and acne. So these are the things we have to look. Investigations we have already discussed all. But the most important thing is not the FBS, but go for post-glucose blood sugar and HbA1c lipid profile if the patient is overweight or acanthosis, hypertensive, and strong family history of diabetes and PCO, or family member who is having early coronary arterial disease. In such patient, go for lipid profile, VGBS, and HbA1c. Management is always a joint effort. What bothers her, treat. What is her need, treat. And what are the risks, minimize. Lifestyle modification is the mainstay. Medical management we will see. So approach is either she has which problem she has, and we want to prevent the complication. When we are explaining diet, just they are the children, just ask them. We cannot tell them that you eat low GI index, but we have to explain that 1 teaspoonful of salt is enough. 4 to 5 teaspoonful of sugar is enough. Avoid fatty food, avoid packaged food, and just explain that whenever you put something in the mouth, just think before, because you want to reduce your weight. Medication will help, but the lifestyle modification is very important. Red color citrus fruit, red color fruits, all cherries, berries, citrus fruit. Yellow will tell us, means these are the colors of the traffic light. So yellow will tell us about the lentils, what we call dal or kathor, all pulses, and green leafy vegetables, specifically broccoli or cabbage group of vegetables and leafy vegetables. So tell them mindful eating, but everything is possible with only and only support of the mother. The whole family has to eat same, and the diet plan should be sustainable. Take help of dietitian. Exercise must be under supervision. We have to tell them. See, generally when we will tell, they will tell that I am doing cycling, I am doing this, I am doing this, but what they need is moderate to severe intensity of aerobic exercise, 60 minutes a day, 4 times a week, along with that strength training, at least 3 times a week. So what we mean by moderate to severe degree of intensity aerobic, when you are doing exercise, you can talk, but you cannot sing. That is moderate, and you cannot talk, you cannot speak. That intensity is severe, and that intensity of exercise is needed. And most important is digital media viewing should be less than 30 to 60 minutes per day. That will regularize. Now, if we will see the relaxation techniques that we have to explain, and if needed for depression, we can take psychiatrist reference. For management of irregular cycle, before prescribing oral contraceptive pill, explain mother that here we are not giving pill for contraceptive. It will not affect her future fertility. It is not harmful to her body. On the contrary, it will balance her androgen, reduce her androgen hormone, and along with that, if she will do like weight management, then the result will be excellent. Explain all the warning signs of OC pill, 3 monthly follow-up. There is nothing like a magic box. The effect will start gradually. For acne, at least 6 months. For hirsutism, 9 to 12 months or even more. And she can continue till 2 years. Data are still available for 3 to 5 years also. Don't use in the girl which are having high risk. So all the contraindications of OC pill that we have to just have a look on that. Now, what is ISHRE guideline? And all the guidelines say that for clinical and biochemical androgen excess and menstrual irregularity, the OC pill is the drug of choice. There is no difference in the efficacy, whichever you use. So when we are giving estrogen and progesterone combination, basically it increases the sex hormone binding globulin and reduces the free androgen. And available pills are, we have a second, third, fourth generation of the pill. But if we see the levonorgestrel is having some androgenic property, then compared to desogestrel, it is more androgenic. And drospirenone is having anti-androgenic properties. So when there is androgen excess, it is the better to give drospirenone ethinyl estradiol combination. But according to the survey, all pills are working. But if we think logically, then ethinyl estradiol drospirenone containing pill will help. Within 2 years post-menarche, it will affect the peak bone mass. So avoid as far as possible during that time. Suppose if mother says that I don't want to give such pills to my daughter, then for regularization of cycle, we can use progesterone for 15 days. But this will not take much care of androgen excess. Now, when we will give ethinyl estradiol cyproterone combination, it is used in moderate to severe hirsutism and acne. Here also, drospirenone containing pills are equally effective. Cyproterone is a potent anti-androgenic. It increases the triglyceride and increases the VT risk. So be careful for that. Now, combined oral contraceptive pill will regularize the cycle, decreases the hyperandrogenemia, but the problem is with compliance. And second thing is the effect will start gradually. So, but still it is the mainstay. There are anti-androgenic drug available, which is spironolactone and finasteride, but these drugs are used when there is COCP, either she is not tolerating or contraindicated and she is having severe hirsutism, which is not responding to COC and cosmetic therapy. In that case, spironolactone, that is, which blocks the androgen receptors, and finasteride are used. When we will give metformin to adolescents, so when her body mass index is more than 25, she is pre-diabetic with impaired glucose tolerance test and lifestyle modification. Along with that, we can prescribe metformin. The advantage it reduces the insulin resistance and hyperinsulinemia. GI side effects are common. So as we have discussed with that, the guideline says that for acne, COCP, either drospirenone containing, or if it is moderate to severe, then we can give cyproterone containing. This is the local treatment with benzoyl peroxide, topical retinoids, local. This slide is very beautiful. And in which type of what we will give, that they have, this here is beautifully mentioned. In hirsutism also, we have to give pill. These are the different hair removal methods. This all take care by our skin friends, dermat friends. Now, newer therapeutic options are N-acetylcysteine, ionositol, vitamin D supplementation, chromium supplementation, everything. We have data in adult, but we don't have data so far for adolescent. So once that we'll get the data, we can use that. Now, the mother's common question: I don't want to give hormone to my daughter. So how much I can wait? So there is no perfect guidelines, but as with the talk with our endocrinologist friends, they said that they can wait till 2 months or 8 weeks. Otherwise, then if she will not take any medicine, then there are all the chances of heavy bleeding sometimes. Is PCO reversible? Then we have to explain that if you will reduce your weight, if you will take the treatment, if you will take the hormone, then reduce the weight, then the symptoms are reversible. But a word about lean and thin PCO, it is difficult to reverse. But still here, the problem is because of the insulin resistance only. For her, the healthy dietary habits are very important. The complication will be less severe than the obese one, but she also has to follow the same rules. How long I have to take treatment? So it is a lifelong journey with her. Lifestyle modification she has to follow regularly, for which she need her family support. So in conclusion, diagnostic criteria for PCOS during adolescence are different than the adult. It will include irregular menstrual cycle according to time post-menarche, evidence of clinical hyperandrogenism and or biochemical hyperandrogenism. Polycystic ovarian morphology is not used as a diagnostic criteria. Girls who have a features of PCOS, either of the criteria, put her under the label of at risk. Lifestyle modification, we must use liberally, judicious use of hormones and prioritize metabolic management, and adolescents should not be diagnosed with PCOS on morphology. I'm thankful to our skin specialist friend, Dr. KB Pandya, Dr. Chetan Dave, Dr. Krupali Balara, and Pooja, dietitian. These are my references. Thank you very much.
Thank you, Dr. Ami. That was great. I request our respected chairpersons to sum up the session, please.
Dr. Raju Bhai.
Thank you, Ami-ben, for your explaining about adolescence PCO excellently. It was an excellent talk on adolescence. I think we are over-treating adolescent PCO by just observing the ultrasound picture. As far as success is concerned for the treatment of adolescence PCO, involvement of family members are very important as far as lifestyle management and exercise are concerned. Without their involvement, we won't be able to succeed. Thank you very much, Ami-ben.
Thank you, sir.
Thank you very much. Thank you very much, sir. So it's been a session that has been very exhaustive, but has been running on time, as Pankaj Desai sir would say. So thanks a lot, Sogo and Dr. Ami, Rajesh sir, and our chairpersons, our guests, because it takes everyone's effort to help a program run on time. Similarly, I'm going to start the panel now. And so may I share the screen and start?
Oh, yes.
So as we all know, the panel today is on POCSO Act, and there are 16 panelists who are going to bombard sir with questions. And this is not just enough. These are the questions that have been allotted. But if you have any more questions, you're most welcome to ask them once the program is done. So I would like to introduce MC Patel sir, though this is his home turf and I don't think he needs an introduction here, but still, because he's going for president, it's my duty to remind everyone of all his achievements. So he's a gynecologist and medico-legal consultant, Vice President FOGSI 2018, Organizing Secretary ICOG 2017, was the Chairperson of Ethics and Medico-Legal Committee FOGSI 2011 to 2013, Honorary Secretary of SOGO, Organizing Chairperson MMCon 2018, Honorary Member National Inspection and Monitoring Committee, PCPNDT Act, Honorary Member, State Supervisory Board, PNDT Committee, Gujarat. He was the President of Ahmedabad Obstetric Gynec Society 2010 to 11. Honorary Member, National Managing Body, Indian Red Cross Society, National President, National Medicos Association, and many other things. But more than this, what everybody knows, what everybody in FOGSI all over the country knows, that he really is just a phone call away. If you are in a soup, if you are in a problem, if you need any kind of guidance, MC sir is just a phone call away. So here, that's me, and I've been already introduced. I'm the moderator for the session. These are our respected panelists. and I will be introducing them one by one as they come in to ask their questions. Welcome, respected panelists. It's been a real joy talking to you and really getting to know you all a bit. So with this is a short video made by Sir.
Madam, voice is not coming.
I think there is some audio problem, but in this
Yeah.
video,
Now audio is running, but now which visual is going? Yes.
Asad, are you going
I
to?
will share it again, just a second.
Okay.
Then just click share, Sam, when you
Yeah.
sharing the screen.
Yes.
शुभं करोतु कल्याणम् आरोग्यं सुखसम्पदम्.
Respected seniors and dear colleagues, serving Foxy for years together on this auspicious day with folded hands and down head, I seek your guidance, blessings, and support to endorse my candidature for the post of Foxy President year 2026, election year 2024. Consistently working for Foxy and trying to visit even a smaller societies and to assist our common Foxian friends in any given situation, I have tried to serve Foxy. I assure to serve Foxy in the same way with the same zeal and enthusiasm. पथ का अंतिम लक्ष्य नहीं, सिंहासन चढ़ते जाना, लिए सभी को साथ, आगे है बढ़ते जाना.
Thank you, sir. And now we proceed to our panel. So the first question is to be asked by Dr. Puneet Khatri, sir, who's the president of Bhuj Society. And he is interested in infertility and endoscopy, but more than that, he has presented a paper on calcium in PIH in an international conference, the first one to do so. Welcome, Puneet, sir. Bhavik, he's not there.
So Bhavik can take.
Ji, sir, Puneet sir has to travel somewhere and he was self-driving. He just messaged few minutes ago that he will not be able to join because he's
you can
You
take.
take the question, Dr. Bhavik.
So sir has got beautiful question. Because we are dealing with Foxo and we are gynecologists, we used always to deal with girl. So sir, question is who is child in Foxo Act? What is Foxo Act actually? And does Foxo Act cover boys also? Good question, Puneet sir.
So which child? So as per
So please answer.
Yes, as per POXO Act, any child less than 18 years is child. So it is less than 18 years. What is
Okay, sir.
POXO Act? It is prevention of a child sexual offenses, and it addresses sexual harassment, sexual assault, aggravated form of sexual assault, penetrative form of sexual assault, aggravated form of sexual assault, and use of a child or children in pornography. So this is POXO Act. And does POXO Act cover boys also? Yes. POXO is gender equal. So it covers both girl and boy.
Thank you, sir.
Great, sir.
Thank you, sir. And now we have the next question for Bhavik, sir. So Bhavik is the secretary of Bhuj Society, and for our viewers, he is a lifestyle change enthusiast, a lifestyle coach, and the first person he tried it was on himself. He has lost 26 kilograms from 108 to 83 over 3 years just by skipping dinner. So over to you, Bhavik sir, for your question now. Dr. Bhavik?
Yes, ma'am. My question was, what is sexual harassment? Sir has nicely described the POCSO Act, but what actually forms sexual harassment? What is sexual assault? What is aggravated form of sexual assault, and what is penetrative sexual assault? And what is
Bhavik, sir.
aggravated form
Bhavik,
of
sir.
penetrative?
Bhavik sir,
Yes, ma'am.
ask
I'm
one
audible.
by one and he will keep answering like a
Okay,
rapid
got it,
fire.
ma'am. Yes. Sir, what is sexual harassment? First, tell us that.
Yes. So in any form of this sexual problems are concerned under POCSO Act, very common word used is sexual intent. So any person with sexual intent utters any words or make any sound or makes any gesture or exhibits any object or part of body with intention that words or sound will be heard by child and gesture of object or part of body will be seen by child is sexual harassment. And it is, if we go further, then it is also said, make a child to exhibit, same way. It is not necessary that person who exhibits is a sexual harassment, but if he insists child to exhibit his body or body part and with intention of sexual intent, then it is called sexual harassment. And shows any object to a child in a form of media or pornographic purpose is considered a child, sexual harassment. One more area as far as child sexual harassment part is concerned, whenever any person with sexual intent repeatedly or constantly follows or watches or contacts child or children directly or through electronic media or social media, it is also sexual harassment. Here, it is not necessary that he has to touch child. Without touching child, whenever he does this type of activity with sexual intent, it is called sexual harassment.
Okay, got it, sir. Sir, then what is aggravated form of sexual harassment?
So when it is done by any family member, because family member is in a position of trust by that child, or say for example in a hospital doctor, in a school teacher, say for example in a jail superintendent. So they are in a position of trust. So when this type of persons perform this type of sexual harassment with sexual intent, then it is an aggravated form of sexual harassment.
Okay.
And
then what is sexual assault?
when patient is mentally ill, then also it is considered as a aggravated form of sexual harassment.
Achha. Okay, sir, what is sexual assault and what is the difference between harassment and assault?
So in harassment, no need to touch.
Okay.
And in sexual assault, it is described in section 7 of POCSO Act, whosoever with sexual intent, here word sexual intent is also there, touches vagina, penis, anus, breast of a child, or make a child to touch vagina, penis, anus, breast of such person or any other person. So in here this in sexual assault, to touch is very important thing, and sexual intent is very much important. And does any other act with sexual intent which involves physical contact without penetration. Here penetration is not must, but even if it touches, then also it is considered as a case of sexual assault.
Okay, got it. So there is non-penetrative assault. Non-penetrative will also be called
Yes.
that sexual assault.
Sexual assault, yes.
Okay, then
Even,
what?
even if he touches with sexual intent, touches vagina, penis, breast, perineum, then also it is considered as a sexual assault.
Okay, so what is
Or
penetrative
make child
sexual
to touch. Equally important, if he makes
is
child
it?
to touch, then also it becomes a case of sexual assault.
Okay, got it, sir. So what is penetrative sexual assault and aggravated penetrative sexual assault?
So again, in penetrative sexual assault, when he penetrates penis or any object of part of body to any extent, it is not necessary it should be full penetration, any extent into vagina, mouth, urethra, anus of a child, or make child to do so. If he insists child to penetrate his penis or any part of his body into mouth, urethra, anus of any other child or any other person, then it is called a penetrative form of sexual assault. And just I prescribed during aggravated form of sexual harassment, when patient is mentally ill, it is called a aggravated form of penetrative sexual assault when it is done by this type of patient, when patient is mentally ill. Or in this type of situation when person is in a position of trust, just I mentioned prior also, any family member, in a hospital doctor, in a jail superintendent, in a school teacher, if they does penetrative form of sexual assault, this is called aggravated form of sexual penetrative sexual assault.
So how about husband of a 15-year-old girl?
Whenever patient is less than 18 years, it is considered as a sexual assault, penetrative form or non-penetrative form.
We'll call it as aggravated penetrative.
Irrespective of her marital status.
Okay, okay.
POCSO Act is very clear. It doesn't deal with marital status. It deals with only age.
Age,
And
yes.
when patient is less than 18, anybody, even if he is her husband, then also it becomes a case of POCSO.
Got it, sir. Thank you.
Thank you, Dr. Bhavik. And now may I invite Dr. Hinaben Patel. Hinaben is the president of Jamnagar Society, and she is a voracious reader. So welcome, Hinaben.
Yes. No.
Hinaben, I think you have logged in with two devices.
Okay, sir.
You switch off one. Otherwise, there will be echo.
Okay. Okay, I'll unmute.
Yes. You log out from one device and continue with only one device.
Okay, sir.
Yes, Hinaben, are you ready?
She's logged in from one, sir. Right now, she's logged in from one, but she isn't saying anything.
One Hina is showing in the list, yes.
Yeah. Hinaben?
Are you there, Dr.
He may
Hinaben?
not be aware of that.
Dhirubhai, you are sitting in front. Would you like to take this?
Yes, no problem.
Yes.
Yeah, so in the interest of time, when she joins in, we'll give her some other question.
Okay, no problem. Sir, what is the provision of punishment for sexual assault or imprisonment? What is
there is very stringent punishment as far as POXO Act's provisions are concerned, ranging from 3 years imprisonment to lifetime imprisonment, and in few of the cases, death sentence also.
and what was the amendment in POXO Act?
So there was amendment in 2019, and there were a very good amendment, and punishment was increased from lifetime imprisonment to death sentence in few of the cases. And one more thing was added in this amendment: whatever fine is done, so amount collected as a fine will be given to the victim for rehabilitation and treatment part also. So this was amendment done in 2019.
And what was the amendment in IPC related to child sexual
Yes.
offense?
So in IPC section 376, actually section 375 is section for rape, and
Rape.
376 is a punishment prescribed for act of rape. So in that very section 376 of IPC, in section 376DA, it was amended that when child is less than 16,
Okay.
it is for less than any child of 18 years, but particularly when child is less than 16 and she is a victim of sexual assault or penetrative form of sexual assault by one person or more than one person, then there is a provision of imprisonment of lifetime. And in this situation, not to one person, but all the persons involved in the act will be punished with imprisonment of lifetime. It was amended by in IPC section 376. And one more amendment came, 376DB. When child is less than 12 years, and if she is assaulted in a penetrative form of assault by one person or more than one person, then provision of punishment is death sentence. So these were two stringent amendments as far as punishment part related to sexual offenses to the children are concerned.
Which are provision for the child pornography?
So the same, as far as child pornography is concerned, if any child is used for the purpose of child, pornography, there is a provision of imprisonment as well as fine also. And in this, if person himself or herself is involved in that pornography, then all the section of sexual harassment, sexual assault, penetrative form of sexual assault, aggravated form of sexual assault or penetrative form of sexual assault will also be considered. So if child is used for pornography is one area, and if at the time of using child for pornography each person himself or herself is also involved, then they will be punished in a different way. So from 3 years imprisonment to lifetime imprisonment is the provision.
Now, what is the punishment for repeating sending pornography to child? Sending by WhatsApp or Facebook?
Same. As far as any pornographic problems are concerned, they are punished with imprisonment of 5 years and even more than that in few of the cases with fine.
Okay. Thank you, sir.
Yes.
Thank you, sir. Thank you,
Okay.
Dr. Taravia. So
Yes.
now we have Dr. Deepal Bhalodia. She is the secretary of Jamnagar Society with a special interest in music and cooking and exploring the world. So over to you, Dr. Deepal.
Good evening, sir.
Yes.
My question is, a 17-year-old girl comes with her boyfriend to you and asks for the contraceptive advice. What will you do? Either you advise or not.
So very, very interesting situation. In our day-to-day practice, many a time this type of situation may happen. Patient is 17 years, means less than 18 years. If she comes with her boyfriend, boyfriend could be minor, could be major also, doesn't matter. But as far as contraceptive advice are concerned, So here there are two situations. If you are advising 17 years old girl, as far as contraceptive part is concerned, because here there are two situations. One part is moral duty and one part is law. As far as our moral duty is concerned, if they have decided to go for active sexual life, naturally, if we do not advise contraceptive measures, they will end up into pregnancy. And ultimately, they will be to us only for termination of pregnancy. But at the same time, as far as law part is concerned, if we advise, then we are helping them to constitute crime, because it is considered as an abatement. And what is abatement? Three words were used for abatement. That is to instigate, to help, or to aid person to constitute. So if one person instigate any person to do sexual assault or penetrative form of sexual assault, it is abatement. If any person helps or if any person aids to constitute. So if we advise them contraceptive measures, then it is considered in eye of law many a times that you are helping them to constitute crime. So it becomes very difficult for us in this type of situation. But here there is one situation. She is not active partner. Active partner is her boyfriend. If you have not advised her boyfriend, and if you have advised only her, then she is passive partner. So many times this could be a good argument if at all you are facing this type of situation in court of law. But it is always better not to prescribe any contraceptive measure. You can teach them as far as health education is concerned. What is safe sex? How not to end up into unwanted or unplanned pregnancy in future. But you cannot prescribe contraceptive measures in this type of situation. If boy is asking, say for example, and if boy is more than 21, then you can very well advise because he is major. He doesn't come under POXO. But if he is less than 18 and if he is active partner, he is boy, and if you advise contraceptive measures to him, then you are advising him a contraceptive measure to encourage him to constitute crime. So same way you have to go for health education only and not to prescribe any contraceptive measures.
So can we ask
Thank you,
this
sir.
girl to come
Thank
with
you.
guardian?
Sir, one question is also require any proof of age? Suppose 17 is a borderline for the 18. So is it required for any proof? Most of are said that I am 20 or more than 18.
So it is always better to determine age in this type of situation because in eye of law, you are under obligation to determine age.
Yes.
So whenever you are in a little doubt, ask for any ID proof, Aadhaar card, election card, school living certificate, driving license. And if you are sure that she is having age more than 18, you are out of purview of POXO. But if it is less than, she is less than 18, and you come to know that she is a victim of sexual offense, then you are under obligation to inform police. So age determination is very much required. I would like to share one example which happened in state of Tamil Nadu only. Girl with her mother visited hospital of our gynecologist friend. She was practicing ART and she was ready to be ovum donor. I am talking this incident happened before this ART Act came into existence. She was ready for ovum donor. She produced Aadhaar card. In and their Aadhaar card, her age was shown 21. And by looking also by her build, she was looking more than 20. So she was entered in this ovum donation program. After 1 year, one day police came and said that that girl was minor. And minor cannot enter into ovum donation program. So both the doctors from that very hospital were arrested and case was filed against them. And Health Minister of Tamil Nadu State ordered that all the hospitals involved in this type of activity should be closed, and hospitals were closed. Of course, she preferred appeal in higher fora. She won the case. Hospital was open. Now order is stayed, and she is doing her practice. But even if she produced Aadhaar card, that very Aadhaar card was fake. So whenever you ask for Aadhaar card, try to verify, or whenever you are going to attach that copy of Aadhaar card with your case paper, then get it attested by patient. Because if it is attested by patient, we can have a defense that patient attested that Aadhaar card, and this is forgery on part of patient to give us a false evidence of Aadhaar card, and we are saved in court of law. But we should be very careful whenever we have a little doubt as far as age part is concerned. Because
Okay.
if she is minor, we have to inform police. If she is major, fine, we are out of purview of POCSO Act.
Thank you, sir. Thank you. My request to all panelists, we'll take questions at the end, please. So now I invite Varsha-ben Dhruv, who is a president of Rajkot Obstetric Gynec Society. She has 30 years of private practice and focuses on high-risk cases. So kudos to you, ma'am. In private practice, doing high risk, please proceed.
Thank you, Asha ma'am, for kind introduction. And thank you, MC Patel sir, for inviting me and making a part of this webinar. My question is, if 18 years and 6 month old married girl is brought by her mother with pregnancy of 39 weeks, and she is for LSCS, what will you do?
So now she is 18 plus 4 months. So she is major. But she is having pregnancy 9 months and some weeks, you mentioned.
39 weeks.
39 weeks. So at the time of conception, she was minor.
Yeah.
So it becomes a case of POCSO. You can proceed with delivery, whether normal or cesarean section as per indication, but you will have to inform police. If it is an emergency, you have to deal with the situation accordingly to deliver patient or go with cesarean section. But before patient leaves your premises, you are under obligation to inform police as far as this POCSO part is concerned.
Okay. Is there any issue of child marriage?
So
That is
here it comes a child marriage, but in eye of law, it is considered as an irregular marriage, not illegal marriage. If she is less than 18 and if she is married. So what is irregular marriage? In irregular marriage, at any time, any partner, if declines that I am not ready to continue with this marriage, then she is free. She is free to be out of this marriage. But if she is major and if she has entered marriage, then she has to go as far as judicial separation or divorce are concerned. But in this type of situation, when she is minor and she is married, she is having irregular marriage. But irrespective of her marital status, when she is minor and when she is a victim of sexual offense, we are under obligation to inform police.
okay. Thank you, sir. And best wishes for next election.
Thank you. Thank you.
We would like to see you as a president of Foxy and represent Gujarat. Thank you, sir.
But it will not be sufficient simply to wish me. You will have to see that each and every voter from Rajkot should
Yes.
vote, because
Yes,
once
sir.
they will open ballot, they will vote for me only. I am quite sure. But they should, and one request to you and all the president and secretaries of respective societies who have joined this. For any region, during this election which happened just few days back, any member of your society couldn't vote, didn't vote me, I couldn't vote for any region. Please inquire with the Foxy why they couldn't vote. Because many times, if there is degree certificate of that the member is not reached to Foxy and they are not able to vote. So give a message in your society that anybody who couldn't vote, not having ballot paper or so, please inform. And whenever this members informs you, please write down to Foxy, these many members from our society couldn't vote for any reason. Please specify reason so that we can rectify that region and they can vote in future as far as Foxy election is concerned. So please do this also for any of your member who couldn't vote.
Okay.
Dharmesh bhai. Dharmesh bhai.
Yes, ma'am.
Yeah, so I would like to introduce Dharmesh bhai, who's the secretary of Rajkot Obstetric Gynec Society, and he is very, very focused on sports. He's captain of Gynec cricket team. State IMA volleyball championship was won by their team in 2022. So Dharmesh bhai, you can take this question. Varsha ma'am probably took yours. So please take this question.
Okay, sir. I'm pleased to ask the question to sir that 16-year-old girl is brought by her mother with complaint of vulvovaginitis with discharge per vagina. On examination, it is found to be case of sexually transmitted disease. She gives the history of sexual exposure with her boyfriend. Now, sir, what will you suggest to do?
So she is 16, she is case of STD. She has also revealed history of sexual exposure with her boyfriend. So it becomes a case of POXO, sexual offense. So we have to inform, of course, we have to treat patient because utmost duty on part of treating doctor is to treat patient. But in this situation, we will have to inform police. We will have a swab to confirm diagnosis as far as STD part is concerned. We will offer all the treatment as far as STD part is concerned. But we will have to inform police.
Okay, sir. Thank you, sir.
Yes.
Thank you, sir. Thank you. Now we have Dr. Piyush Vadalia, and one thing about him that I would like everybody to know that he has been working for the last 22 years with an NGO, Vanvasi Kalyan Parishad. I know they have a branch in Raipur also, where they work for children from the Northeast, and it's an excellent organization. So welcome, Piyush sir.
Hello.
Yes,
sir.
yes, welcome,
Yes.
Piyush bhai.
Thank you, madam. And a good evening, MC Patel, sir.
Yes, welcome, good evening.
Sir, my question is 17-year-old girl with mother visits hospital with 6 weeks of pregnancy for termination of pregnancy, and doctor explains to inform police, but patient and mother refuses for the same and leave the hospital without taking any treatment further. What will you do?
So again, here patient is 17 years, so she is minor.
Yes.
And it becomes a case of POXO. So even if she takes further treatment with you or not, but once you have come to know that she is a victim of sexual offense, you are under obligation to inform police.
Thank you, sir. Got it.
Thank you, sir.
Yes.
Now, may we have Dr. Devraj Bhadarka. He is also a private practitioner working for IEF and is interested in movies, travel, and bodybuilding. So, sir, let us have your video on and please take this question.
Yes, Dr. Devraj.
Sir,
If he is not present, Piyush bhai can take.
Hina ma'am, are you there?
Yes, madam.
So
Ma'am, you
Hina
please
madam
take
can
this
also
question.
take.
Can you hear me?
Yes,
Yes, ma'am.
yes, madam.
What is the role of doctor when victim is brought to him? And second part is what is expected under POXO Act about reporting of offense?
So whenever this type of patient is brought to us, any doctor, gynecologist or any family physician also, we have to examine patient, we have to treat patient, and we have to form opinion whether she is a case of victim of sexual offense. And as far as your second question, what is expected under POXO Act about reporting of the offense? So during your with your examination, if you come to know, or if you have all the positive signs that she is victim of sexual assault or sexual offense, you are under obligation to inform police.
Okay. So, but means in all cases, you have to examine the patient and then only we can inform the police, no? Only.
Usually, whenever we examine patient, then only we can come to know that whether she is a case of victim as far as sexual offenses.
No, when the patient comes with the mother and they disclose that she's exposed to sexual life, so we need not believe
No, no,
that.
no.
We have to examine and
many a time history could be wrong, because to harass somebody due to their personal rivalry, they may give wrong history also. So we have to go with history, examination, and findings, and then we have to come to conclusion whether she is victim of sexual offense or she is lying.
Okay, sir. Got it.
Thank you, ma'am. And Dr. Bhadarka, are you still there? Our next question is to Dr. Hira. Is from Dr. Hira, who is a photography and traveling enthusiast. Is he there? Is he there?
Doesn't seem in the list.
Dr. Hira sir is president of Porbandar Society, and if he is not there, anybody can take.
Dr. Dharmesh, would you take this question, please?
Dr. Dharmesh?
Yes, ma'am.
Yes, welcome.
So the question is, what is the provision in case of failure to report or record a case? And after that, how to inform?
So, if we come across any case of sexual offense when patient is less than 18, it becomes a case of POXO, and we are under obligation to inform police under section 19 of POXO Act. And if we fail to report for any reason, then under section 21, there is a provision of imprisonment of 6 months and with fine. And if we are a head of the institution where more than one doctors are working, then there is a provision of imprisonment of 1 year. So we have to inform police in this type of situation. It is very much needed, because we cannot afford imprisonment of 6 months or 1 year. And as far as how to inform, so whenever we inform police, we have to inform with acknowledgement, because many times it may happen that police may say, you didn't inform. So we have to prove in court of law that we had informed police in this type of situation. So whenever we inform, we have to inform with acknowledgement.
Okay, sir. Thank you.
Yes.
Thank you, sir. Hina ma'am.
Yes, madam.
So you are here. Would you take this question? Dr. Jignesh Modi has not been able to join today because there's been some problem in his family.
Okay. Can you hear me?
Yes, ma'am.
Duty of a doctor, how to deal with a case of sexual assault. That is the first part.
So whenever this type of cases are brought to us, just I mentioned prior also, examination, treatment, and form opinion. And as far as examination part is concerned, first we have to take consent of patient. And when patient is more than 12 years, even if she is minor, less than 18, she can give consent for examination. So we have to take consent first. And when she gives consent, then we have to examine. So first history taking. So she will give history about her problem. And during examination, we have to go with all the injury marks over face, over breast, over thigh, perineum. So all the injury marks we have to mention. We have to see with other signs of sexual assault also. We have to go with stain on clothes, particularly in garments, stain of blood, stain of saliva, stain of some lubricants. So we have to see for that also. and then we have to come to conclusion whether she case of sexual assault or so. But at the time of taking history, we have to mention very important questions also. Say, for example, time since this incident happens. Because if it is fresh one, we will have all the signs at the time of examination. But if time is past, much time is, say, for example, it has happened 7 days back or 1 month ago, then it will be difficult for us also to find certain sign to come to conclusion. So we have to inquire about that also. We have to inquire about whether she has taken bath after this incident happened or whether she has changed the cloth. So these are very important questions we have to ask before entering into examination.
And second part is, can sedation be considered for examination of a victim?
Yes. If child has given us a consent for examination, and if it is painful, patient is not comfortable to be examined, then we can have a consent from guardian as far as sedation part is concerned, and we can give sedation to the patient as far as examination part is concerned. Many a time, not only examination, we have to intervene for treatment also. Say, for example, she is bleeding or some foreign body inside, then also we have to intervene. So in this situation, naturally sedation or any anesthesia will be required. So with consent of guardian, we can consider sedation or anesthesia also for examination and for intervention for treatment part is concerned.
And one more thing, one query, that if the examination can be done in the presence of a parent or a guardian, or we have to, we should not allow them to enter when we are examining.
So under POCSO Act, we have to allow relative, we can allow relative, but before that, in this type of situation, we will ask victim separately, is she comfortable to allow any of his or her relative to be present at the time of examination? Because many a time, person who is accompanying the patient could be accused. And in this type of situation, patient may not be comfortable to be examined in his or her presence. So first we will ask patient whether he or she is comfortable to allow his or her relative, and if she is comfortable, then we can allow relative inside examination room, and we can very well proceed with examination accordingly.
Okay, thank you, sir.
Yes.
Thank you, sir. So we have Dr. Dhiren Taravia, sir.
Thank you, Asha.
Yes, sir.
My question is, what is the role of doctor as an expert witness in cases of sexual assault or rape?
So, being an expert person, and we are the person, first point contact, rather we can say. Whenever in this type of situation, patient either brought to us by family members or relative.
Hello.
Should I continue?
Yes, sir.
Yes. So many times patient might be brought by relative or from school by school teacher or from some any other person also. So in this type of situation, our role is to examine patient, to treat. We have to offer prophylaxis for STD also, and we have to form opinion. So this is our duty. So in this type of situation, whenever we form opinion, we are expert witness in court of law in this type of situation, and we are requested to be present in court of law to give our expert opinion as far as this incidents happened. And we have to opine whether she was victim of sexual offense under POCSO Act or not.
Sir, can a doctor refuse to examine the victim of sexual assault who come to the hospital for the treatment, or?
No, doctor cannot refuse. whenever this type of patient is brought to us by relative or any other person or by police, we are under obligation to examine, treat, give prophylaxis and form opinion. We cannot refuse.
Okay, sitting the MLC case and require the police requisition or
No,
magistrate.
no. In this type, of course, if police has brought the patient, it is already informed to the police. But even if patient is brought by some other person other than police, and police is not informed, then also merely on that ground that it is a MLC case, you have to inform police, then only we can examine or we can treat. Nothing like this. We have to examine, we have to treat, we have to form opinion, and then we have to inform police.
Okay, we should keep the record also.
Yes, naturally, we will have to keep record.
Police
Because-
requisition or magistrate order. One
No,
copy.
no,
we
no. For examination of this type of victim patient, no order from magistrate or any court is required. Any patient is brought to us by anybody, we are under obligation to examine and to treat. In
Sir,
emergency.
excuse me, I have a query because I was in government hospital. All
Yes.
the private practitioners do not take up this. They almost indirectly or orally or verbally they refuse. Still, no action has been taken so far. We have not heard about that.
But even if it is just gone to the notice of police, then they will be inquired why you didn't inform police. Because whenever you come to know, because in POXO Act, it is very specifically mentioned that notwithstanding anything contained in code or criminal procedure code, whenever any responsible citizen of India comes to know that she or he is victim of sexual offense under POXO Act, he is under obligation to inform police. If he has examined or he has come to know that she is a case of sexual victim, sexual offense, and if he has straightway referred patient to government hospital or any other hospital, and if there's some inquiry occurs, then he will be in a big trouble, because not informing police, he may invite under section 21, I mentioned prior also, imprisonment of 6 months. So it is not easy. But
thank you, sir.
But I would like to share one example also, how funny it happened in city of Mumbai only. Patient was brought to sonologist directly by her mother because she had complained of pain in lower abdomen and she had found some lump in abdomen. So on sonographic examination, she was found 6 months pregnant. So her mother brought her to gynecologist. So gynecologist went through the clinical examination and that sonography report. Gynecologist informed police. Police went to sonologist. Why you didn't inform police when you come to know that she is pregnant and she is minor? So irrespective whether you are treating further or not, once you come to know that she is minor, she is victim of sexual offense, whether she is pregnant or not, doesn't matter. You are under obligation to inform police.
Okay, thank you, sir.
Thank you, sir.
Yes.
So I forgot to tell that Dr. Dhiren sir runs a high-risk Mohalla clinic for the last 10 years. He loves dancing and he also is part of a trust that educates students and does their marriages. So it's highly commendable work that is being done by different members of SOGOG. Hats off to you all, and it's been a pleasure knowing all of you. So now next, I would like to call Dr. Deepti Vyas ma'am. She is the past president of Rajkot Society. She is very fond of music.
Jamnagar Society. Past president, Jamnagar Society.
Okay, Jamnagar Society, and she loves to cook and make very healthy recipes. Gujaratis love to eat and she likes to make those recipes healthy. So over to you, Deepti ma'am.
She is probably not there. Jigna ma'am can take her question.
Yes, sir. Good afternoon, everyone.
Yes, good afternoon.
Jigna ma'am, just a second. So if Jigna ma'am is taking this question, She works at a corporate. She's FMF certified. She has done her training from Gynec Academy for Fetal Medicine. And her passion is public awareness and drama. So welcome, Jigna ma'am. Over to you.
Thank you, Asha madam, for introducing me. I'm very happy for meeting you all in this platform. And I also thank Dr. MC Patel sir, who is almost like a leader of all over Gujarat and also Foxy future leader for India, Foxy also. So my question is to you, sir. 17-year, hello.
Yes, yes.
Yes, ma'am.
17-year-old girl visits a private hospital with history of sexual assault. The doctor asks her to go to a government hospital as it is a MLC case and has to be examined by a government doctor. Is it mandatory that a victim of sexual assault has to be examined at government hospitals only? And is it necessary for a female doctor only to examine sexual violence victims, sir?
Partially it was answered prior also. So merely on that ground, it is a MLC case, we cannot refuse, and one has to examine patient, treat patient, and form opinion and inform police. As far as female doctor part is concerned, it is preferable if female doctor is available, then that very victim should be examined and treated by female doctor. But if female doctor is not available, and if, say for example, if she is bleeding, or if she has some other problem and she needs treatment immediately, then in this situation, we have to examine patient and we have to treat patient, irrespective whether female doctor is available or male doctor is available.
Sir, but my query was that when I was going through this act on this act applies to both male and boy and girl also. So simultaneously, is it true that female gynecologist can examine male boy of 13, 14?
Yes, whenever this type of victims are brought to you, you can examine, you can form your opinion, and you can refer patient, because we are not well versed to deal with treatment as
boys,
male boy is concerned. We can refer patient to respective doctor for further treatment. But merely on that ground, I cannot examine could not be the answer. We can examine, we can mark all the injury marks, etc., and we can form opinion.
And if male doctor is examining the female girl, then attendant, female attendant has to be there.
Naturally. Not for POXO Act only, in any other case. In routine OPD, routine examination also, whenever male doctor is examining female patient, one of her relative and one female staff should be present in that examination. It is very much required.
Yes, sir.
Thank you. Dr. Jigna, may I proceed to the next question now?
Yes, madam.
So that is to be taken by Dr. Nalini Anand. That is a situation, and ma'am is a voracious reader and is interested in everything new, reading, traveling. She is professor and HOD obstetric gynae at GMC, Jamnagar. Welcome, ma'am.
Thank you, ma'am, for your... Hello?
Yes,
Thank you.
Welcome. You are audible.
We can hear you.
Yeah. Sir, many congratulations on this really good academic feast and continuing all through almost, I think, more than a year now. Sir, my question to you... Hello?
Yes, welcome.
The slide has changed. So my question to you, sir, is about a girl who is 17 years of age. She's in relationship with a boy and she has missed her periods. Now she's anxious that what if she is pregnant? Now she's worried that if she's already pregnant and if her parents come to know that what will happen. Worried. She also discloses that she was worried about her conservative parents who would not, how they are going to react, and whether she should continue with pregnancy, whether she should continue with her studies. As a doctor, what should we do? Irrespective of the girl's choice or against her choice, do we need to inform the police? Whether we have to inform the parents with or without the girl's consent, and whether we have to counsel the girl. I think this question is partly answered by you earlier as well. Still, whether you should be counseling the girl about safe sex and advice about pregnancy and care.
So as far as to inform police is concerned, we are under obligation. It is mandatory rather to inform police, irrespective of her wish, will or desire, because we have not to go for consent of patient to inform police. So we have to inform police. What question was other? Whether to inform girl's parents.
Yes,
So,
sir. Whether we should inform
yes,
with
yes.
or without her parents'
So,
consent.
so if she is more than 12 years and if she refuses to inform her parents, we cannot inform her parents. So it is very clear in a law also. But as far as to inform police, we have to inform police. What was one more question?
Whether we have to counsel the girl regarding safe sex practices.
Naturally, we have to counsel not to have this type of activity in unsafe way. Otherwise, she may end up into any kind of infection or unwanted pregnancy, etc.
But previously.
Yes, I have answered already.
Yes, sir. But previously, you have answered that we should not be counseling her for contraception.
We can counsel but not prescribe. Because if we prescribe, it becomes a proof of abandonment to encourage them to constitute crime.
Okay. Okay, sir. Yes, sir. Thank you, sir.
Yes, welcome.
So Jigna, over to you again.
Yes, madam. Question is, a 17 years old girl had eloped with her boyfriend and became pregnant with 16 weeks of gestation, and she comes to the doctor and requesting for MTP. Now she is not willing to reveal her boyfriend name and requesting not to inform to the police. Now basically it is 16 weeks, so definitely we have to admit her. So now her father is refusing to give consent for MTP. Then what should doctor do? Whose consent should be taken?
So she is 17 and she has eloped with her boyfriend. She is not willing to reveal her boyfriend's name. Fine. So again, it becomes a case of POXO. We have to inform police, and for that, no consent of patient is required. But if she is not ready to give name of her boyfriend, we cannot insist if she is more than 12 years. Because if she is more than 12 years, she has all the right, because of course she is minor, but in eye of law, she is considered matured minor. So she has all the right not to reveal name of her boyfriend. And if she is requesting not to inform police, we have not to entertain that, because we are under obligation to inform police. Her father is refusing to give consent for termination of pregnancy. So in this situation, if any guardian, not necessarily he should be his father or she should be her mother, any guardian who guards the patient can give consent who is major and mentally sound. And in this type of situation, we can inform CWC, that is Child Welfare Committee, and any member of Child Welfare Committee also can give consent on behalf of her to terminate pregnancy. And in this type of issue, we can terminate pregnancy.
Sir, but my question is that whenever we are filling the MTP form, in which if this girl says that I am ready to sign, okay, so the first part, if she signs, then also guardians, in case of minor, the second part which is there below, that is required.
When she is minor, she cannot give consent for termination.
She cannot sign.
Because her consent is not valid in eye of law. So to terminate pregnancy when she is less than 18, we have to go with consent of guardian. And what is the word guardian means? Any person who guards the patient is guardian. Need not to be, he or she should be her family member. So any person who is guarding the patient and if he or she is ready to give consent, we can terminate pregnancy.
In sir, indication in this case, only failure of contraceptive measures.
No. She is minor, and if this pregnancy is continued, it will be detrimental to her physical health or mental health. We can
Okay.
consider that.
Okay, sir.
Hmm.
Okay.
And a pregnancy caused by rape. This is
Rape
also one
also
more
will be.
indication.
Rape can
Hmm.
be done.
But rape तो sir क्या थी? कारण के it was willing with the boyfriend ने तो.
I just mentioned she cannot give consent for intercourse when she is less than 18. If that consent is
Okay.
not valid consent in eye of law.
Okay. Okay, sir. Thank you.
Yes.
Thank you, Dr. Jigna. I hope your doubts are solved. And now
Yes,
we
madam.
have our last question. This is to be taken by Dr. Madhav Hirani, though I cannot see him here probably.
Actually, ma'am.
Yes, Gopal bhai, you can take.
Yeah. Madhav just went with some emergency. Just I on behalf, just asking to
No,
sir
sir.
this question.
Just a second, sir. Let me say
Yeah,
a
yeah.
few words about him. So he is a private doctor with an infertility and laparoscopic setup. And what he said was that he is more an entrepreneur now. So he is looking for new businesses and ventures in Africa and loves music. So that is our Madhav Hirani for you. And over to you, Gopal, sir.
But just he came here just
Yes, welcome.
once informed to Child Welfare Committee, father considered for MTP, sir. MTP done, and now father is insisting for product of conception to be sent for further investigation. But the girl says she does not want to implicate boyfriend with DNA analysis. What doctor should do? So regarding argument of father is that only he can decide what should be done to the product of conception because he has consented for MTP. And other thing is argument regarding the girl says that product of conception were recovered from her body and she has right to decide the future of her body products. So how this problem?
Very interesting situation.
Yeah.
Previously, father refused to give consent. But when CWC was informed, now father was ready to give consent for termination of pregnancy and pregnancy was terminated. In this situation, father has demanded that product of conception should be sent for DNA examination. Again, when she is more than 12 and less than 18, we cannot insist for product of conception to be sent for DNA examination. We cannot insist to declare name of boyfriend also. So in this situation, we have to inform police. Police is informed, pregnancy is terminated, fine. And product of conception cannot be sent for further investigation if she is not willing. So it is clear. Argument of girl that product of conception were recovered from her body is very much right and she can take decision. As far as argument on part of father that he had given consent for termination of pregnancy doesn't stand in court of law. He gave consent for termination of pregnancy, fine. But as far as body part is concerned, recovered after termination of pregnancy, it is all the rights of that girl only. And when she is more than 12, less than 18, she can take decision whether to send it for DNA examination or not. And it is up to that girl only.
Sir, one question.
Yes.
Who is one question that who are the members of the Child Welfare Committee? How it is formed?
So it is formed by government. In many cities, it is already there. And in this type of situation, whenever any person approaches CWC, they take all the care of child to take a victim to the center for examination, for treatment, and even if it is required termination of pregnancy or in legal matter also, they are considered good witnesses also. So this is as per as POCSO Act is concerned, this is provision to form Child Welfare Committee in each district.
Okay. So district wise, at least
Yes,
there is
yes.
a committee.
There are so many centers. It is called 1-point contact center, and any rape victim, any sexual assault victim will approach that center, and all the care thereafter will be taken by that center only.
Okay. And if the pregnancy is beyond, say, I mean, as per MTP law, all the provisions are there just as in MTP that they can continue
You specify weeks of pregnancy and I will answer accordingly.
Say, suppose it is 28 weeks, 30 weeks.
Yes. So up to 24 weeks, with opinion of 2 registered medical practitioner, pregnancy can be terminated. But in this, when it is a case of POXO, we will have to give that product of conception, that is fetus or placenta or so, to police for further investigation if patient has given a consent. If it is more than 24 weeks and that very pregnancy is having fetus with congenital malformation which are incompatible with life of fetus, then medical board can opine that pregnancy can be terminated. If pregnancy is very normal and if she is a rape victim or sexual offense victim, then we will have to seek permission from Honorable Court seeking writ petition as far as termination of pregnancy is concerned.
Okay. Okay. Thank you, sir.
Sir, one question more.
Yes, Dhiren.
One court summons came to from Surendranagar court that you give the whole detail and record for the delivery. Yeah, I asked the police 10 years back, one full-term normal delivery, female live 2.5, and a second delivery also. So then she divorce and a court case happened. So at that time, I don't know whether marriage is marriage or not marriage. So I really both are in a relationship and child was delivered. So I give the whole record, delivery form, consent form, and court was appreciate. So what happens if second time or how to know whether this type of female?
Again, here it matters age. What was the age of patient?
The patient was very uneducated. And
it doesn't matter educated or uneducated. Age.
At that time, approximately age or 18 to 20, primary gravida. But really later we know that is only 17 year age.
So here it becomes a case of POXO. If she is more than 18, doesn't matter whether she is married or not, you can very well deliver patient. But if she is less than 18, of course you can deliver patient, but you will have to inform police.
Okay, but that time I don't know whether the age is, so I don't inform the police.
So that is why in discussion prior also I insisted, whenever you are in a little doubt about age, always go for age verification by ID proof or clinical examination, dental examination, X-ray, or even if you can refer patient to forensic department also for age verification.
Okay, sir.
Yes.
Sir, I have a few questions.
Yes.
Yes, sir. One is how we should inform police. Can we assign one person in our hospital to inform such cases to police, or should we only do?
No, we can send any person on our behalf, but we should inform police by acknowledgement. Say, for example, you have sent 2 copies, and in 1 copy there should be signature of person who have received that letter. But at that very time, that person should be identified. Name of that person, Bakkal number, because police officer are given Bakkal number, date and time. Many a time, police will refuse to give signature or acknowledgement. So in this situation, it becomes very difficult for us to prove in court of law that we had informed police. So always insist acknowledgement, and if police refuses, then you can have a phone call to 100 number. 100 number is recorded call, and it is proof that you had informed. But before you start informing, you identify the person whom you are informing. What is your name? What is your Bakkal number? Police station, time, date. One thing. Second thing, you can give by registered AD post, you can give information. You can give it by mail. It is also proof. You can have a telephone with recording if you are in your device facility of recording, but again identify the person whom you are informing and preserve that recording. It is good defense in your favor. And you can inform higher officer. If police station level officer is not complying, you can inform higher officer that in this situation they are not complying with us. So these are some means how to inform police.
So this we can just mail them through our hospital email address as well.
Yes, yes. Even from your personal email or from hospital email, it is proof that you had informed.
So can the case of defaming be filed against doctors for this? Why you informed the police has defamed us now?
No, it is very clear. Under provision of any act, whatever you do, it is always pardoned in court of law. And no defamation case stands against you if you have informed police in this type of situation.
Because police has to know that yes, the case will not be filed. Otherwise, they will come with the patient. This fellow has filed a case against you, and now you have to be in the court of law.
So, if it is a case of POXO, if she is minor, and if you have informed, you have done very legal thing. It is not illegal. So you are saved in court of law. As far as other parts are concerned, they are social problem. Patient or relative of patient will argue that we were not interested and why you inform police. So in this situation also, again, you will have to inform police for your safety, if at all, if you have any apprehension that they may go hostile.
And so the last question is that how we can use POXO Act actually to protect kids around us from sexual assault.
I couldn't follow how we should use.
How we should use POXO Act to help kids around us from being saved from sexual assault. એ લોકો સામે sexual assault ઓછા થાય, harassment ઓછા થાય, એના માટે આપણે શું કરી શકીએ?
એના માટે તો education, it is public awareness program should be there that under 18 years of age, any child, male or female, if they are victim of sexual offense, then person who is involved will be punished very stringently from 3 years imprisonment to lifetime, or in few of the cases, death sentence also. So this type of awareness should be created in society. Then only we can give.
ફોક્સી તરફથી સ્કૂલમાં આવા પ્રોગ્રામ રેગ્યુલર ચાલુ
I am coming to that. And
Yes, sir.
In school, we should teach student what is good touch, what is bad touch, and they should come forward to complain, because unless and until they complain, how one can come to know that whether they were victim of this type of sexual offenses.
This complaint was is very good. We can request all these schools to have complaint box in their school, and
Yes.
any kid if is facing such bad touch, they can complain in such complaint
Yes,
box.
naturally.
Great.
Yes, Inaben was asking some question.
No, that was same, that by sex education, I mean, related to last question only, that sex education and openly teaching them partly in schools only, that what is bad touch, what is good touch, how to identify that the opposite person is not in a good, I mean,
I had taken this task when I was president of Ahmedabad OBGYN Society in 2010. Before I took over as a president, I called a meeting of principals of all the school of Ahmedabad, whether they attend or any representative. And I put some situation before them. I am interested to visit your school to teach your student. And I was interested from standard 9, 10th, 11th and 12th students. કિશોરાવસ્થાની સમસ્યાઓ, વૈજ્ઞાનિક સમજ અને એના ઉપાય. These were my title. We prepared PPT in Gujarati also at that time. And we visited more than 65 schools and colleges for this purpose. We were discussing these teenage problems, whether menstrual irregularity, pain, any other problem of hirsutism, acne, etc. we were discussing rubella also, we were discussing AIDS, HIV also. So this type of health education program, we can take over at society level in the school, and it will be very much fruitful to them also. And at the end of lecture, we 2 or 3 gynecologists used to visit school, and one gynecologist will deal with one subject. And at the end, we invite question. And during that lecture, all the girls are there. No male teacher were allowed in that lecture because due to shyness, they will not come forward to ask any question. And we also invited or encouraged them to write in a cheat, not giving any name or so, only question. And all the question we gathered, and from stage only we were giving answer to those questions. So we had a program like this. So we can do this type of program in school, and it will be very much useful to the society also.
Sir, thank you. I sharing the one funny as well as
Yes.
social case. Just happened in before 15 days, 15 દિવસ પહેલા one family નોર્મલી 30 થી 40 ડિલિવરી અમારી ત્યાં થઈ હતી, એટલે પેશન્ટ ને રિલેટિવ ને બહુ ટ્રસ્ટ હતો. પછી પેશન્ટ આવ્યા જસ્ટ ફોર કિડની સેલિંગ, કિડની વેચવા માટે. તો બધું પૂછ્યું ડિટેલમાં. તો પેશન્ટે જસ્ટ કીધું કે આ દેણું થઈ ગયું છે 10-15 લાખનું એમ, અને બધા ફૂલ રડવા માંડ્યા. એટલે આઈ ઇન્ફોર્મ ધ પોલીસ બીકોઝ ધીસ ઇઝ ઇલીગલ એક્શન વોટ એવર. તો 101 માં ફોન કર્યો, પોલીસ માં કર્યો, ઓલે એવું ignored the all condition. Then I also informed the 181 means Avyam. Avyam. The Avyam team will come and explaining Avyam team. Well, I also explaining everything, and then all are reversed. And Avyam team means one crime branch also coming for the Dena Mateni, and all are explaining and giving the good counseling, and then save the both life. Otherwise, both are saying that we are suicide tonight. If we selling the kidney, otherwise we suicide. So I did all action also. And
But
then
now good moment in Gujarat as far as organ donation is concerned.
Yes.
And just for the sake of knowledge, I am involved in eye donation program since long. And
Yes.
I have collected more than 1,000 eye pairs as far as eye donation part is concerned. But now there is a institution, I mean organization rather, for organ donation program. And if we inform that organ donation organization, then they will take care of this type of patient, not to be victimized, only merely on ground of this type of money part is concerned.
Patient wants only just money.
Yes.
Thank you, sir.
Yes.
Thank you. And Dr. Amy has been listening in all through. Dr. Amy, do you want to say something? Means you've been here all along.
Any other delegates who is not faculty and who have joined, and if any question, any doubt, any query, they can either write in chat box or they can raise hand, we will allow.
Sir, I would like to ask
Yes,
a question that, sir, I'm Dr. Jigna, sir.
Jigna, yes, welcome.
Sir, in before last few days, one of the case was very much in discussion in all groups. Sir, somebody was given, this is not with this act, but somebody was given permission by Supreme to terminate the pregnancy at 28 weeks. Because it was delayed. So question was that 28 weeks sir deliver થાય અને live child આવે તો શું એમ. So KCL was exactly, I'm not knowing much what was the case, but I want to hear what was it.
Yes, very interesting situation. I always during my lecture of MTP Act and its amendment, I put last slide, because when this permission more than 24 weeks of pregnancy to be terminated are given, it is all likely that fetus may come alive. So can we give custody to the relative? Many times relative are not ready to take custody. Can we shift that patient, I mean fetus, to NICU? If we are in government hospital, fine, we can shift it to NICU. But if we are in private, who will bear the cost of that NICU? Is there any role of police in this type of situation? So there are so many questions unanswered. And here comes a role of Foxy, role of IMA to clarify this type of situation. One more question was also put by me. Can we consider feticide before termination of
KCL
pregnancy?
આપવું કે નહીં
Yeah.
KCL
Before-
આપીને
but still these are the gray area, so still it is very difficult to say. But in this type of situation, whenever fetus come alive, because in last case which you mentioned, Supreme Court has very specifically mentioned that termination of pregnancy is allowed, but if child comes live, then it is responsibility of government to take utmost care of that child as far as treatment part is concerned, and have a adoption in a appropriate family through legal proceeding. There are so many organizations in Gujarat also. If you find this type of case, you inform me also. I will help you. I will guide you. I will assist you to make this type of child or children to be adopted with respective care, legal care, officially, very legally, to needy family also. This is also possible.
So then the Supreme should have told to wait further for 4 weeks. આટલું થયું તો sir. 28 કાઢીને survival rate.
That can also be taken, but in that given situation, considering the mental health of patient, Supreme Court took decision, because we can appreciate the mental condition of patient also. Going one day by one day, what could be the mental trauma or mental condition of that very patient and family member?
And it was in this case delay by court only, ne? કે 28 થઈ ગયું એમાં delay થયું તું કંઈક.
No.
Yes,
Actually, no.
Mumbai,
No.
I think. Mumbai
Case was like this. They approached lower court denied. They approached high court denied, and they preferred appeal in Supreme Court, challenging the decision of high court, and Supreme Court allowed. So time wasted due to this legal proceeding only.
Okay.
It was in Mumbai, I think, no, sir?
Exactly, I do not know from where, but the judgment came by Supreme Court only.
Supreme Court, yeah. But sir, again, in this case also, we can do counseling of the girl that you carry on pregnancy,
yes,
you have, so
we
that
can-
adoption becomes a good alternative for the baby.
We can counsel, we can advise her to continue, and we should assure her that after delivery, we will take care of that baby to be adopted by appropriate family. So we can do. Long
I
back
think
in my...
we've done it now. You've
Yes.
answered a lot of questions, and I don't think there are any
Thank
more
you, sir.
questions left.
Yes. So again, a request on my part also, please endorse my candidature for post of President Foxy election year 2024. Thank you very much.
All the best, sir. All the best to
Thank
you.
you and all the best.
Yes, thank you.
Sir, I have
Thank
also made a slide.
Yes.
Okay, I want
Welcome.
please announce it.
Yes, and Dr. Asha Jain, she is very hardworking lady in this series. She is long with me, and now she is going to contest for the post of chairperson, Food, Drugs and Medico-Surgical Equipment Committee. So I request all the society president and secretary who have joined this webinar to nominate her candidature at the time of nomination and to vote for her at the time of voting. She is very deserving candidate for this very post.
Thank you,
Best wishes.
Thank you,
Best
sir. Very
wishes
kind
to
of you.
Best wishes to Asha Jain, also Dr. Madam. Please
Thank
continue
you.
your good work.
I'm at the first step in Foxy, and sir is at the top.
Yes.
No.
And one more request to all the participants for today's webinar who are teacher or who had been teacher. They would have very good group of their student also. And now they are voter of Foxy. So they are requested specifically to tell all of your students to vote for me, to support for me.
Okay, sir.
Welcome.
Thank you, sir.
Definitely. Yeah.
Thank you.
Thank you.
And one request to everyone, if you have any suggestions to make this program better, we are open to those suggestions. So you can just message me and sir is very open, to discuss how we make it better, we make it faster. So if any suggestions are there, they are most welcome.
And I would like to take opportunity to thank Corona people and Nilesh in particular, because we are always behind Nilesh. Do this, do that, please correct this. So Nilesh is very cooperative. Of course,
Thank you so much.
he is with us since long in this series, and now he is also used to us, how to
Yes.
work with us. But thank you, Nilesh, for all the help you are supporting this educational activity.
Sir,
Thank
one
you
more
so much.
question, last question.
Yes, yes.
Now this pharma company can conduct our webinars and all, help in the conducting CMEs? No
Yes.
ban has been
Yes,
lifted.
yes,
No,
ma'am,
no.
because it has been put on hold.
Yes, it is put on hold. So previously, how pharma company were sponsoring our educational activity, it will be continued.
Okay.
Till
So it is-
further order. Till further
Till
order.
further order, till further order.
But it has come in writing? I mean,
Yes, yes.
Yes, it is
Yes,
published.
yes. The gadget was on hold.
It is published by government.
okay. Okay.
Nothing
Thank
is
you, sir.
decided.
Thank you all. Thank you.
Thank you,
madam.
everyone.
Thank you,
Sir,
sir.
Thank you
with
so
your
much.
permission, we end the program.
Oh, yes. Oh, yes.
Yes. Thank you, sir.
Namaskar. Good night.
Namaskar.
So,
I'm ending the.
okay. So, thanks to everybody who has joined this webinar. Thank you. Thank you very much. Yes, Nilesh, we
Thank
can
you so
continue.
much. Yes, sir. I'm ending this.